Hey guys, Dr. Megan Jack here. I'm here today with a special treat for you. I am interviewing my partner, Dr. Tim Wilson. Say hello.
Hello, how are you?
I'm good, thanks. It's October and it's Breast Cancer Awareness Month. So what we're doing today at East Tennessee Plastic Surgery is answering our top questions that we get about breast reconstruction. So I'm going to ask some questions that our patients or potential patients may want to ask when they come in for a consultation about breast reconstruction. Does that sound good?
Sounds good.
So what are, Dr. Wilson, the basic types of breast reconstruction out there?
Well, when I think about breast reconstruction, there's two basic ways to do breast reconstruction. There's what we call implant-based reconstruction, which involves implants, sometimes involves tissue expanders prior to the implants, and then there's autologous breast reconstruction, which is reconstruction using the patient's own tissue.
Okay, so their skin and their fat.
Sometimes
Anything
muscle.
Okay. When you do autologous breast reconstruction, are there implants also involved, or is it just our own tissue?
It can go either way. Typically, for the latissimus dorsi breast reconstruction, which is using muscle and skin and fat from the back, more often than not, it requires an implant as well.
Okay, so it just depends.
It depends. Most of the time when the abdominal tissue is being used, there's enough tissue there that you don't have to have an implant.
Oh, wow. Okay. And can I get a final result with one surgery for my breast reconstruction?
Sometimes, but not very often, to be honest.
Okay.
Usually the implant-based reconstructions will start with a tissue expander, although lately we've been doing more and more straight to implant. But there's always room for small tweaks and potentially fat grafting or small revisions to get to the final result that everyone's satisfied with.
As a patient, what would be expected of me to get my best possible result?
To get your best result, you really have to be diligent with your post-operative instructions, particularly the activity restrictions.
Okay.
Because if you try to do too much too soon, you can undo some of the work that we've done on the inside.
Got it. Okay, so do what my doctor says.
That's a good start.
Good rule of thumb? Anything else specific that I can do, say, leading up to surgery or afterwards?
Yeah, certainly avoiding aspirin products for the 2 weeks prior to surgery is a good idea. You know, maintaining a healthy diet and
Oh, okay. Why is that important?
so you'll heal.
Oh, okay. So like scars and wound prevention and things like that.
Yes.
Okay. All right. And then as far as the aesthetic look, because obviously you're a plastic surgeon, we are plastic surgeons, so we care about the final result, the look. How does it look? We want it to look and feel like a breast, a native, original, natural breast. So is there anything that I can do as a patient to help you, as my plastic surgeon, achieve my specific goal of a natural matching breast? Say, for example, going over with you what I want it to look like, or talking about size, or anything like that that would be helpful for you?
Certainly, having an honest, frank conversation with your plastic surgeon regarding your desires and your expectations is important. You know, trying to match a natural breast perfectly is very difficult. Sometimes we can do it, sometimes we can't. We can almost always get to a point where you look natural and comfortable in your clothes. A lot of patients are opting for bilateral breast reconstruction. It is easier to match when you're doing the same thing to both breasts, but there's certainly for most patients, there's no disease advantage or survival advantage or recurrence advantage into having bilateral surgery.
Okay.
But a lot of patients are electing to do that these days.
Okay. All right. If I have cancer in just one breast, how do you go about matching either the reconstructed breast or the unaffected breast so that we get that symmetry as close to perfect as we can?
Yeah, sometimes you don't have to do anything to the non-affected breast. Sometimes a reduction or a lift or an augment, it just really depends on how the patients are put together and what it is that they're looking for.
Okay, but it's possible to get it close.
Yes.
Okay, well we know none of us are perfectly symmetric side by side, right? So there's always going to be little things that aren't exactly perfect, but we try to get close.
Right.
Okay.
But frequently we do symmetry procedures on the opposite breast.
Oh, okay. At the same time, or?
Sometimes it's the same time, and sometimes it's at the second stage or at a later time.
Okay. My last question for you today. How will my reconstructed breast feel? Will it feel natural?
It almost always starts out feeling foreign, like it doesn't belong there. But over time, and typically it takes a couple of months, and the patients report that it feels much more part of them at that point. So it takes some time to get adjusted to it.
Okay. Does it feel soft like a breast? Does it feel firmer? Is it hard to know?
The result we're looking for is a nice, soft, natural feeling breast.
Okay.
There are sometimes factors, in particular radiation, that can affect that. But,
Okay.
most patients can expect to end up with a nice, soft, natural feeling breast.
Okay. Awesome. Well, I hope that was helpful for you guys to hear a few of the questions that we get asked most commonly of our patients. One thing that we want to open up as an option for you guys, if you have additional questions, you can feel free to post them below the video. And then we also are considering doing a live question and answer session with Dr. Wilson either next week or the following week. So if that's of interest to you and you'd like to submit questions for a live Q&A or participate in that, definitely comment below and let us know if that's something you want to do. Then we'll set that up. And if there's a particular day or time of day that works best for you, then comment on that as well, and we'll try to set that up for you. As always, if you don't want to miss out on future East Tennessee plastic surgery videos and special events and announcements, make sure you follow us on social media, subscribe to the YouTube channel, make sure you like our video below, and as always,
Stay beautiful.
You picked it up. All right. Good job. That was great.